Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work mainly with people struggling with autoimmune diseases. In my work with my clients, I help them use food and lifestyle as a way to improve their energy, reduce pain, and just give them their lives back. So treating chronic diseases is always really challenging. And as humans, we are unique, and not all medications or therapies work for everyone. So sometimes it can take a while to figure out the best treatment plan for each person. And while conventional medicine definitely has a place in autoimmune disease treatment, there are also alternative therapies to consider and use in tandem. Today, I'm going to walk you through what some of these treatment options look like and what to consider with each plan before moving forward. So before I jump in, I need to just attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. And that includes any medications, treatments, supplements, anything that you do or take. Okay, so what are some of the conventional treatment options? When you get an autoimmune disease diagnosis, the first goal is to try and reduce inflammation to get your disease under control. There are a number of different therapies conventional doctors use to achieve this. The first one is over-the-counter medications. So the first and easiest option for mild autoimmune disease flares are over-the-counter medications. These do not require a prescription and are not as strong as prescription meds, which is why you can buy them over the counter. The most common ones are non-steroidal anti-inflammatory drugs, or NSAIDs. These include aspirin, ibuprofen, acetaminophen, and naproxen. These are really great at attacking inflammation, but with long-term use, they can cause harm to our stomach and intestinal lining. The next kind of line of defense are prescription drugs. So if over-the-counter medications aren't cutting it, or if your autoimmune disease flare is pretty severe, the next thing that they'll use are prescription drugs. There are quite a few different types that you can experiment with to hopefully give you some relief. And again, this is just very general. Every disease is very specific and may have different protocols, but generally speaking, this is what most are recommended. So the first kind of step, I would say, are using general immune suppressants. So these work to slow or stop the release of cytokines that trigger inflammation or interrupt immune cell signaling to start an inflammatory cascade. These medications include prednisone, Plaquenil, methotrexate, and sulfasalazine. Some of these are fine for long-term use, like Plaquenil and sulfasalazine. Prednisone is a very effective inflammation fighter, but it does have some unappealing side effects when used long-term. Once you kind of get past the general immune suppressants and, maybe they work or maybe they're not working as well, the next step is biologics. So biologics are stronger and more specific immunosuppressants that target specific parts of the immune system. So some of them block certain receptors for inflammatory cytokines and other block cell activity as a whole. Some of these include IL-1 blockers such as Kineret, TNF blockers such as Humira, and IL-6 blockers such as Actemra. While immunosuppressants are the gold standard for treating autoimmune diseases, they can have some pretty nasty side effects. Fatigue is probably the worst one. They also cause gastrointestinal symptoms like nausea, vomiting, diarrhea, and do increase your risk of infection. So those are kind of just very generally the medications that you might be offered when you first are diagnosed, or if your disease is not being managed well. And they can, believe me, they can work wonders for people. But sometimes alternative treatment options might also help. So alternative therapies can work with and independent of conventional therapies to help manage autoimmune diseases. Here are a few of the complementary and alternative medicine, or CAM, options. The first one are supplements. So I've talked a lot about how certain supplements for certain specific autoimmune diseases can really help improve symptoms and lower inflammation. Some of the more general ones include fish oil, turmeric, magnesium, and vitamin D. The second one is body work. So acupuncture, cupping, Reiki, massage may all help alleviate pain and reduce inflammation. More studies are needed to be done on these modalities to see how effective they are. But honestly, they can't hurt, in my opinion. And then diet. Diet can play a huge role in lowering inflammation while reducing symptoms of autoimmune diseases. While it can seem overwhelming, making small changes over time can truly make a difference. And I think diet can be really helpful. And if you can go back to all my other YouTube videos, I talk a lot about diet. It's my bread and butter. So I think it can be very effective. So before starting any treatment, it's important to be an informed patient. The decision is always yours when it comes to different treatment options. And it's really important to ask the following. What is this treatment? How can it help my disease? What does the research say about the success of this treatment? What are the side effects? How long will it take to start working? And how will I know if it's helping? With autoimmune diseases, many times different treatment options are a trial and error process. Not everyone responds the same, and not every drug helps certain conditions. So just to follow up and to recap, today we focused on both conventional and alternative treatments for autoimmune diseases. And again, really important to be an informed patient and ask questions. And even I encourage people to bring a list of questions to the doctor's office when you go, because sometimes you forget to ask and you only have a few minutes with them. So, make sure that you are informed, asking the right questions, and, doing the research. So if you would like help managing your autoimmune disease or just reducing inflammation in general, I would love to chat with you. I offer free 15-minute discovery calls to learn about your goals and to see if we are a good fit for each other. So go to my website, annierubin.com, and you can schedule that free discovery call there. While you're there, you can go to my resources tab and you'll find a bunch of free downloadable items. My favorite one is our simple guide to detox. It gives you kind of the basics of starting a detox plan, what foods to focus on, what lifestyle tips are good to implement to support your body's own natural detox process. And lastly, you can sign up for my weekly newsletter. It comes into your inbox every Thursday. I try to put a lot of great information in that for you to help inform you, educate you, and provide lots of great tips to help you. So you can always sign up and then unsubscribe if you don't find it helpful. So if you enjoyed this video today, hit the little subscribe button. These come out about every week or so. I'm just here to help you, manage your disease, feel better, and give you some tips and tricks to really get your life back. So thanks for joining me, and I will see you next time.